Welcome back, everyone. You're watching We Heart Therapy, the special series EFT Talk. I'm your host, Dr. Belle, licensed marriage and family therapist and certified EFT supervisor and therapist here in fabulous Las Vegas, Nevada. And I'm super excited to be here. Thank you guys again. Just want to say a quick thank you for staying tuned, for subscribing, sending me your feedback. And if you guys haven't bought my book, you can find it on Amazon, Using Relentless Empathy in the Therapeutic Relationship. Just look up Annabelle Bugatti, Relentless Empathy, you'll find it. And make sure you guys check out We Heart Therapy for wehearttherapy.com for retreats that I am now running under my brand for We Heart Therapy. And I have one coming up later this year. So if you'd like to come and join, love to have you. Make sure you check that out. And so I'm super excited today. If you are watching this on video, you're already going to see hopefully a familiar face. If you guys have been along for the ride with We Heart Therapy, we have Michael Barnett. He's one of our EFT trainers. He was originally in Atlanta, and now he's in Los Angeles. And he's one of our trainers that specializes in addiction. And he also just wrote a book. Woohoo! We're super excited. So he wrote an EFT therapy workbook for addiction. And it goes into healing shame and loneliness that drive addiction. And this is for the general public and also for you therapists, just to have in your arsenal of tools to recommend. And just, I'd recommend getting a copy so you can thumb through it and be able to firmly recommend it to your clients. It's a phenomenal resource. So I'm super excited to have Michael back today. And we're going to be talking, more about addiction and the role of shame and trauma in the addiction cycle. So thank you, Michael, for being on our show again.
Well, thank you for having me. It's a pleasure. It's nice to see you again. And I look forward to just getting into conversation with you about, addiction and EFT. It has certainly been my passion, and I've spent the last couple of years bringing this work into the addiction world. Mm-hmm. And it's being met with a lot of interest, which is really, really cool. Attachment's kind of a buzzword out there right now, but I don't think anyone applies attachment to therapy the way that we do, especially in the addiction world. So
that's so true.
Yeah.
And, so before we get started, I'd love if, just sort of occurred to me, a lot of modalities think, oh, addiction, like maybe you can't do couples therapy. Mm-hmm. And so I know EFT has a different approach to addiction and couples therapy. Could you maybe speak to how EFT sees addiction differently and how our approach to contraindications is a little bit different than maybe the typical field's approach to contraindications?
Great set of questions. Interestingly, the notion of contraindication is what prompted me to really do the deep dive into working with addiction and trying to bring that alive within the EFT community initially. And I remember even before the international organization was created, the fledgling listserv was available, and I kept seeing these posts where people would say, oh my gosh, I just did this assessment with a couple, and one of the partners is, showing signs of some form of substance use disorder, so I have to refer this person out. And the first decade of my career was all in the addiction world. So therefore, all of my network and referrals were coming from that world, and I was having success working with them, but I was having to tailor the model in a certain way. And spent the last many years trying to operationalize essentially how I did that. Like, what do you do to make this work? So I say all of that because I found it works really well. And there are, of course, stipulations that we have to work with that help it work well. But the main thing that makes, I think, our work really relevant to the addiction world is when we bring the focus of attachment as kind of our mainstay of how we navigate therapy. Essentially, when loving others have not been an option for people to lean into, and there's either modeling for substance use or substance or any kind of addictive behavior is kind of available or prompted somehow, it actually becomes a very weirdly spoken an adaptive response to people coping with pain and distress alone. Mm-hmm. Sadly, though, the solution ends up becoming a huge problem and takes on a life of its own.
Mhm.
So the way we see that in EFT is very distinct from the vast majority of the field that looks at it as either a brain disease, which is the popular model right now, or it's just an issue to be fixed with a new set of skills, rather than paying attention to the fact that people are essentially trying to self-medicate something that's very difficult, very painful, and usually of an emotional nature.
Yeah, like you mean not turning to the medication is not a lasting way to get them to stop turning towards the medication? Like just take the
Exactly.
medication away.
No,
Yeah.
exactly.
So I love that. So in EFT, the contraindications for us might just be more of, we won't go into maybe stage 2 work until, certain parts of the addiction are remediated, maybe not necessarily achieve full recovery, but there's some level of stability. And we'll talk about that through our conversation, but we don't necessarily say, oh my gosh, somebody has addiction, like cancel couples therapy, they need to go to individual. Just, I think people think, oh, somehow it's going to be hurting their partner more or something, and their partner's already being affected by it, and it's still happening whether we talk about in couples therapy or not. So, if they're going through it together, being impacted by it together, it makes sense to work on it together, so at least we can all be on the same page, collectively work on it, and again help them navigate this even as they enter into all that entails.
Well, and what you're saying has many touch points in the field of addiction itself. People are encouraged not to bring their distress around their using to their partners, which of course then in turn shuts the partner out and creates more relational distress, which is a trigger for relapse. So what we're really doing is embodying EFT the way we typically embody it, but creating partners as another resource for people coping with the pain that drives addiction, rather than partners as a trigger. And as obvious as that sounds, that's fairly revolutionary. That's not what is happening in the treatment world for the most part.
Right. And then what I hear come up a lot in that place too is that, oh, for having the partner be a part of the healing solution, is that like putting responsibility on them, is like their sponsor somehow, which I know is not necessarily what we're saying, but could you speak to that?
Yeah, and I think that's where the wisdom, if I will call it that generously, I think, of what has been part and part of the addiction field, or certainly a 12-step aspect of the field, is not getting partners involved, so it doesn't essentially foist the burden of the using partner's healing on their partner. I think it came from that wisdom and that intention. But the way I think about it is, if the more tools people have in the tool belt, the better. So if they have a sponsor, for example, or they have a 12-step group that's a home group, or they have other folks they can lean into, that's great. Hopefully their significant others are also going to be resources as well, and they can confide in them and lean into them and find support in them and be able to actually get the emotional reassurance that people have been very unsuccessfully and ineffectively trying to get from substances or behaviors. So we really do want to invite the partners in. They're an enormously important part of the healing process.
Mm-hmm. Which is also very revolutionary, because I can hear like the voice of a lot of therapists kind of rising up and saying, oh, but does that again somehow mean like they're responsible for their healing, or something about boundaries, or and it's like they're in this relationship regardless, and they're in this relationship and suffering from addiction, and it affects their partner too. And wouldn't it be better, if the partner doesn't know how to work in conjunction to help healing, then inadvertently and quite accidentally, they could be doing things that may, set off triggers. Again, it's not a fault finding or anything, but a lot of, especially even with trauma, a lot of partners and all humans brush up against those things. And, I think you're saying like it's not necessarily about fault or responsibility, though maybe that just speaks to the larger dynamic of being in a relationship when one person is really struggling, has some pain has trauma or addiction, like, I guess that's an interesting conversation about the role of the relationship versus responsibility, and what kind of responsibility is on us as partners. What's the right kind? What's the wrong kind?
Well, I think in many ways, you're knocking on the door of something I've heard people who are not all that acquainted with EFT, but in the field will talk about.
Yes.
Are we kind of infantilizing partners by having them be part and parcel of their partner's healing process? And I would say, and I know you would too, no, not at all. As a matter of fact, it's almost like EFT uses like a life hack, if you will, a developmental life hack of, if you had the iconic image of the mother-infant gaze, and we know how if you were to extrapolate from that, if that was your predominant experience in life with loving others, you're going to come out of that experience with your neural networks optimally developed, your sense of self very strong, confident, pliable, present, your sense of other, trusting they're going to be there. But when people don't have that, and if that is how nature has organized things for us to really evolve optimally, and substances are part and parcel of the process, it's no different than what we're inviting partners to do in EFT. What we're trying to do is create the opportunity for people to have consistent experiences in therapy when the same pain that the using partner has been trying to self-medicate with addictive processes comes up. We want to help set the stage for them having experiences initially in the therapy to lean into their partner and find out, oh my gosh, this goes well. I can trust somebody, or I must be lovable enough for this person who I hold in such high esteem to shine love and empathy on me in these moments of distress, rather than saying, I want nothing to do with you, or worse, right?
Yeah.
So,
I totally agree. I kind of feel like that those questions around responsibility, which I brought up intentionally because I'm sure therapists not trained in EFT are probably finding their way into this. So, I think that idea of responsibility comes from a detachment, like, I'm trying to get away from, rather than when you are with somebody who's struggling. Again, we're not saying it's your problem to fix. And again, we're saying people in general aren't problems to be fixed. They're people to be loved. And, part of the reason why you're in that relationship to begin with is because you took on the role of wanting to love this person and be loved by them. And here's this thing that they struggle with that gets in the way for both of you. You're both impacted, even though they're the one using it. Affects both of you. So why wouldn't we want to be a part of that if we knew that our love, our acceptance of them as a human being, again, not necessarily their behaviors or their coping strategies, but them as a human being, seeing them as lovable, we knew how powerful that can really be as part of the healing journey. Why wouldn't we want to harness that?
100%. Yeah. And then, your choice of like focusing on responsibility, I think that's important only because, if not for any other reason, because in the field of addiction, it's talked about that way. And this is where we can kind of bump into EFT's perspective, which is relational and through attachment, right? Or some of what has organized the addiction field, which is very individualistic, and people kind of operate in their own silos and work their own programs. And this is where my boundaries are. I start and stop here, and you start and stop there, and you have yours and I have mine. And we're saying, no, we know, biologically speaking, we need each other. And significant others have access to such deep parts of one another that they can be such profound resources for healing. That's the journey we're embarking on with working with addiction through this model.
And usually, the emotions and the pain driving the addiction have a lot to do with being cut off from those loving resources at some point to begin with. So doing more of the same and trying to heal it, as they say, just gets us back on the cycle of insanity. Why would we do more of the thing that's already been a part of what's driving the addiction? It's the antidote to shame, to trauma, to that isolation and pain is love, is connection. And we know that someone suffering with addiction, it doesn't affect their partners and their relationship in silos. So, we don't have to be the one who caused the pain in order to be a part of the healing solution.
Exactly right. That's exactly right. As you've been alluding to, addiction descends on a relationship, and all parties are affected, whether they're families or couples or any other organization of a relationship.
Yeah. So if you can sort of speak to, Michael, an EFT, so if somebody's coming to therapy that has addiction, is there like, I imagine maybe therapists might be asking, is there a certain like level of addictive and like intensity that is like required for them to be able to handle the work, or like, how is the structure of EFT initially when working? Is there any reason or any type of addiction or level of addiction that might affect our ability to proceed even slowly with stage 1 of EFT?
Sure. And there are times it will be contraindicated too to use EFT. So, as you're well aware of, and one that's a multi-level question, but there's so many variables, right? There's so many variables from the intrapsychic variables to the interpersonal variables, and then I would kind of expand beyond that to what kind of impact has the addiction had on the relationship. There are some relationships in which addiction has created so many intense injuries that if the using partner is unable to maintain essentially sobriety, that it rips the scab off to all of the unhealed injuries. And if that happens enough, then we can't create safety in our sessions, right? We can't in good conscience help the non-using partner lean in and become vulnerable because their partner might relapse or something could happen. It's just not safe. And another aspect that we're always having to pay a lot of attention to is because addiction alters the emotional process of people so intensely, can the using partner tolerate the work? And what we're really starting to pay attention there to is pacing. So how are we going to be very attuned to both people, or if there are more people in the relationship, how are we going to be attuned to family members, attuned to partners, and see what they can tolerate? But in some way, shape, or form, we have to be able to bring the addictive process in just the same way we weave people's attachment strategies into the cycle. We would have to do the exact same thing. Sometimes I think about addiction as the fifth strategy, because it affects people who use every single strategy, but it can also show up as a real factor that is going to prime a reaction from a partner. So I hope I answered that okay.
Yeah, so it sounds like, there might be some instances where, it might be difficult. I think it's sort of like how far we can get in EFT. Doesn't mean that we can't do EFT. I think the biggest part is pacing. And I love also that you said to create safety versus waiting till there's safety. Because as I always say, if we're waiting for safety to happen, we're never going to start therapy. That's why they come to therapy. We got to help them co-create safety. But, being able to bring that addictive process in, so it could even be understood that somebody might still be using. And, of course, what we work on in therapy may bring them closer to the things that trigger them to use, because again, it's their coping strategy. Doesn't mean we avoid doing the therapy because they might use, because they're going to do that anyway, right? But we're not necessarily going to progress with our work in terms of vulnerability with the other partner until we have some stability where we can start being emotional, like being more open with our emotions, and maybe part of like that de-escalation stage, as we call in EFT, that creating stability is that, maybe partner A, who's the non-using partner, and you jump in, tell me, Michael, like, maybe they can be able to at least even talk about feeling impacted by the addiction without it, on some level, without it, totally shutting the other person down and them going into addiction. And they can even start to communicate and be a little more present with their own emotional experience without instantly going into the addiction. No, I think relapses are a common part of the healing process. But again, I think it's that sense of, in fact, as I'm saying this, I almost think working with addiction is sort of unique in EFT in that we almost have to be set up and prepared for more rupture repair to be a part of the process, as relapses can rupture, and we sort of expect that that's going to be part of the process until someone's made full recovery, as we're walking them into their pain, trying to help them experience their pain without self-medicating with addiction. And the deeper we get, occasionally, even as they've reached a level of stability and we go into stage 2 and they're starting to get vulnerable, could be a relapse, right? And it's almost something we're not surprised by, right? So it's really like a scaffold. And, you're saying stage 1, our early work, if there is active addiction, is to really be careful with the pacing, that the work we're going to do about putting the addiction into the cycle and working with that may not necessarily include asking the non-using partner to be deeply vulnerable yet. Am I getting that right?
That would certainly be a part of it. There again, we're getting kind of the lay of the land, understanding the history of addictive processes within a relationship, understanding the impact that's had on a relationship. And it would not be unusual. As a matter of fact, it would be pretty typical for me to put some behavioral interventions in place, or at least talk to, in a very collaborative, respectful way, the using partner about what would you think about maybe tabling you're using for a couple weeks? Could that be possible? And in some ways, it's very diagnostic, because if we meet, let's say, once a week over the next 2 weeks, and that person has been able to do that, I'm really getting a sense that we can move forward with the therapy in a fairly familiar way. Mm-hmm. If pretty quickly you find out, this person has not been able to do anything to rein in their addictive process, it can also be a sign that we may need higher levels of support in the therapy, that couples therapy is not going to be enough. Mm-hmm. So maybe they need to find a 12-step group. Maybe they need to get individual therapy. If we find some additional levels of support and that still doesn't work, maybe an IOP, or if that doesn't, some residential treatment. It just depends on what we're really looking at and the extent of the addiction. And people are not always very comfortable with being direct about the addictive process. There's a lot of shame in it. Partners can protect one another in really curious ways about really acknowledging what's really taking place. So we will proceed trying to understand the couple, get a sense of them, and a sense of where, how far along in the addictive process people really may be. And then again, assessing injuries, because some relationships cannot tolerate somebody continuing to use. Some relationships can evolve where a person does moderation management and not go into full abstinence, and that works for this particular couple. Mm-hmm. So there's so many variables. That's really what I was trying to explain. But to your point, the stage 1 process we'll be much more cautious about. We're going to really pay a lot of attention to, as we bring people into the deeper end of their emotional experience. Is that going to be something that primes a relapse, or is that going to be something that primes connection? We don't know what's going to happen there, right? So there are a lot of question marks as we proceed.
So what I think I hear you saying ultimately is, if someone comes in and there's active addiction, it doesn't necessarily mean stop and cancel couples therapy. It means a lot of assessment. And, if we deem that it's, okay to proceed, we're just going to proceed very, very slowly and delicately. And each session is going to be just continued ongoing assessment, which is actually natural and inherent in the EFT process. And, I just thought of a circumstance where it may not be safe is if, the partner's ending the substance, depending on the level of addiction and the type of addiction, if there could be like catastrophic consequences to health, like if them quitting could lead to, like severe, their life could be in danger, then we need to protect the safety of their life first, you know.
No,
So,
exactly. Their life could be in danger. Let's say they were gambling away the family's resources. They got intoxicated and mentioned somehow they were driving their kid from carpool. There are certain places we're going to have to say this is a real contraindication. Or the other thing we have to pay attention to is as we move people into emotional process and they start experiencing their emotional worlds, does the therapy become a trigger for people to relapse from, right? And so we have to pay attention to, is there safety in doing the therapy, period? In which case we have to assess, do we need to back off some and just keep things a lot lighter, or is this
right.
amenable to therapy?
I like what you're saying. Back off some, not necessarily doing less sessions, but tempering the pace, right?
Right.
Really, it's about tempering the pace because again, like we sort of almost anticipate that going deeper is even the therapy sessions probably will be a trigger, you know. But again, if we can't talk about that and deal with it on that level, they're never going to get help, right? So it just means we're going to set a lot of scaffolding, go really, really slow, you know, and just little bit at a time so that we can help. I think that again, the first part is co-create safety so that they can even stop using and not, you know, like diminish the felt need to turn towards addiction when intense emotions start to come online.
No, that's exactly right. And I think one of the greatest gifts that our model brings to working with addiction is the centrality of the use of the attachment frame and attachment processes, because when we start humanizing the using partner's pain and experience that kind of dovetails into them actually using, we are countering the shame that the using partner tends to bring in. They come in often feeling like the identified patient. Like I had a guy tell me about 5 or 6 sessions in, he said, I thought this was going to be couples court and I'm going to be the guy on the stand here. But when he started talking more about his pain and started getting more in touch with the ability to language some of his inner world with his partner, she was so responsive and she never understood that part of her world. And the other thing that we start pulling in is when we can create safety along the way and that shame seems to dissipate some, when the non-using partner begins to talk about their pain, we're starting to facilitate an open channel for attachment. And that way the using partner starts to genuinely have a kind of a crisis of conscience in that moment about, I'm hurting the person I love the most and I don't want to be doing that. And the reason this pain hurts so much is because this addiction is taking me away from the person I really love and who really loves me. And so the way we are incorporating that in vivo in a very emotionally alive way becomes a really powerful force in helping people move away from whatever kind of addictive process they're using and move more toward their partner. So we're continuing to try to what is that thing called? Like pump the bellows there, you know, and flame and kind of create that attachment flame. So it's burning brighter and brighter, and people take more risks and find more comfort in the relationship rather than comfort in the substance or behavior that they've been using. So that's
Right.
unique to our model, and so helpful.
Yeah. Yeah. Or, you know, even if they're not even to the place of finding comfort where they're just numbing out the pain, right? But then turning towards their partner, because often underneath, you know, what you even talk about in your book about shame, right? And, you know, in EFT, we say guilt is I did something bad, shame is I am bad, I'm unworthy, I'm undeserving in some way. And so a lot of times somebody believes they're unworthy, then with their emotional pain, there's sort of the sense of I don't deserve to get comfort. And so I have to deal with this pain. And so I turn to, you know, whatever my substance is to sort of numb out that pain. I may not even be finding comfort explicitly, but I'm just trying to not feel that pain, which can feel like comfort when you're just not feeling the pain, but it's not even close to the same thing, right? And
That's a great point.
you know, so I think a big part of it is also seeing, so in early stage 1 of EFT, the beginning of EFT is recognizing addiction through the lens of attachment as people suffering with pain. It's part of the emotional process. And being able to map out, identify, get clear with them, sort of the anatomy of the role that it serves in the emotional and attachment process. What functions it serves that seem like it's somehow benefiting them in some way, helping them in some way, but then also highlighting what it's also costing them, without coming across as judgmental.
Exactly. And bringing that alive in the room, right? So we don't even have to name it in that way, but as we're talking about what they're self-medicating, it has a secondary impact on the person they love the most. And now we're in a really different world, right? And that person wouldn't be negatively affected if they didn't love their using partner. Mm-hmm. So now we're in the world of attachment, and we're using this as kind of a channel to help people start to love and feel loved. Mm-hmm. And start to begin to inch toward having alternatives to using, which is so key. And I think our model works beautifully with addiction.
Yeah. And yet it's funny because, so I always think about that line from the song Nature Boy, the greatest thing you'll ever learn is just to love and be loved in return, which is the heart and soul of EFT, is helping people find this. And then, I'm thinking of therapists, when they're working with trauma and addiction, and they're thinking, well, how does somebody, let's say like a veteran, who's gone through war, how would that have anything to do with attachment? And I'm like, it has everything to do with attachment, right? It's about how they human. I mean, I've had veterans come in for intensives that had very significant levels of addiction and very significant levels of trauma that, unfortunately, they were never able to talk about, even though it seems like it's encouraged by programs for veterans for them to seek help. It's also, there's a lot of stigma against it, and a lot of negative repercussions, and so it still isn't quite where it could be and should be. So when we got into this trauma, so the some of my clients haven't even talked to their spouses about it, and they're doing things in wartime that violate the code of humanity, and then they're not supposed to talk about it, and they're trained that you're not even supposed to feel bad about what you did, but really it does, because they're still humans, and they're saying, hey, maybe I took a life, and that really impacted me, and I'm not allowed to talk about it. And they're seeing faces of people that they might have killed. And then of course it's like, when you really understand the core level of what they're coping with and what they're trying to numb out, then the addiction, the level of addiction even starts to make sense. And I found it so helpful even for the partners. Are like, oh my God, this makes so much. Now I know what my partner's dealing with, where I never knew before. I was always on the outside, and it was like I was feeling hurt by their addiction and all the things that they're doing. And yeah, it still sucks. It's still painful, but also now I know a lot better what's going on, and now it makes sense. So there's like, the empathy sort of opens up some emotional space for us to get to work, rather than sort of being stuck on the other side of like that push-pull. Why don't you just stop this? And I don't understand it. And
no, it's so true. The empathy does, and the incredible shock and awe of a veteran when they share at that level that their partner isn't just rejecting them or judging them, and instead is showering them with love. Mm-hmm. And it becomes a very different moment, right? Mm-hmm. It becomes a very healing moment that's really unimaginable. And to your point, it starts to shine a brighter light for the partner about why their spouse or significant other might be using, just to kind of keep the demons at bay, right? Mm-hmm. And so as we open those channels up where people can begin to share what they're coping with on the inside, take the risk, which is a huge risk. Like, loving and being loved is no easy task. It's an easy phrase, but it's no easy task. But to show warts and all the parts that you can't even embrace yourself about yourself,
Yeah.
come on and find out that they will still love you. And that's the power of our model, particularly when we're working with significant others. Those few people that we let into that inner sanctum of our hearts, they have so much meaning, but the risk is exponential, right?
Yeah.
I show you this stuff and you do head for the hills. What does that mean for me, right?
Right. Which is probably more of the same of what they got even before they started using. It's like, if I really show you me, if I really let myself be seen and known here, if you really knew the things that I've done, or who I really am, then you would see that I don't really deserve to be loved, that I'm a terrible human being, you know? And that's a really painful place to be. And of course, they're coping with that. And the part of them that's in relationship is still hoping that they can be lovable, even though they have a really hard time taking that risk to bring themselves in. There's like that disconnect even within themselves, is that I still hope and desire to love and be loved. And yet there's a deeper part of me that's terrified that if you only knew me, if you only knew the things that I've done, then you wouldn't love me. I wouldn't be lovable, and you'll head for the hills. And so then I cope with it in this way. And then when I cope with it in this way and it hurts you, and then you want to run for the hills,
It's a vicious cycle, right? Right there. That's it exactly. It has everything to do with addiction, what you're saying.
Yeah. And that's exactly why we see people as stuck, not sick, right? Is because, we keep doing the same things to cope and getting the same response, and we know that we're not getting a different response, yet we keep doing the same thing to cope with it and somehow hoping like, is this going to be different somehow? And it's not. It's like the cycle of insanity, doing the same thing, hoping for a different outcome. And yet it's not. And we get stuck there because we don't know what else to do. So we often keep doing the same thing, even though we know it's costing us. And usually that's how they end up at our door, or, they've suffered enough societal consequences to bring themselves to your door,
So whether we're talking about people's basic steps in the dance, in the cycle, right? Or that step involving using, it's the same thing, right? It's an attempt at a solution, is what I'm hearing you kind of bring into our conversation here. It's an attempt at some kind of solution. And sadly, the solution makes the problem worse. And with addiction, the thing that's unique about it is that particular solution will take on a life of its own and can potentially be life-threatening.
Yes.
That's what.
Well, yeah, and that's a good point. First and foremost is, yes, not everybody, but a lot of people with addiction don't see their addiction as the problem. Of course not, because it's seen as a solution to the problem. So we've got to understand, what is it the solution to, but also, like you said, the addiction takes on a life of its own and has all kinds of impact. And I think part of how people even know that it's an addiction, especially when it's around, maybe the thing that they turn to doesn't have as immediate of consequences, other things like maybe food addiction or something. But when it does start to have an impact and we keep going despite the cost, despite like, hey, now I'm suffering health consequences, the doctor is telling me I need to stop doing this, or I'm like almost losing my house because of gambling or whatever it is, it's like at that point they keep going despite even early consequences, saying, hey, pay attention. That's how you can even start to know that this is on that level. Because there's lots of stuff that's even legal stuff that people can become addicted to.
We do, the thing in, like I'd say, in common culture is people are going to focus on the addictive substance. That's the problem that you're using. That's the problem. They're not talking about why people are using. But the reality is, we know, like, people can get addicted to anything, and you can get a lot of attaboys and attagirls where you could be a workaholic. And look at the way you're performing for your company, and then you get all these financial rewards and you get status. But meanwhile, your relationships are falling apart, your health is falling apart, you're not doing the things that bring a ton of meaning into your life. So what are people really trying to self-medicate? And there can be very culturally accepted forms. Exercise is a great one too, right? You look fit, you're doing these things that are purportedly healthy, but in the meantime, again, it's depleting other areas of life. So
Right. And I have many clients with eating disorders that uh,
Yes.
they're exercising as a way of like punishing or purging. And definitely it has relational consequences where, parts of their family or their relationship feel like exercise is now more important than spending time with me. Like they see the punishing, and the punishing takes on such a life, that they're like, oh, every time this happens, they go away from me and they're doing this, and it feels like there's no room for me in this picture because it's always them out there doing that. And so it's, I love what you're saying, EFT. We start on the basis of recognizing that, again, it does mean something. Attachment is an existential science. It's not just about bonding. That's like a tenth of what it's about. It's a science about how we understand ourselves and the people in the world, and how we interpret the experiences we have, how we feel about those, and then how we subsequently behave. It's all inextricably tied, and it has everything to do with our existence. So we recognize that, these people are suffering, that there's something in there about their addiction that will make sense, that, we try to understand it, which keeps us out of judgment. And keeping us out of judgment is what helps build safety in the relationship, helps keep us be able to work with them without losing our own mind, or helping their partners lose theirs, right? When there's empathy, then our tolerance to hold the pain and work through the process becomes a lot bigger, our capacity, which helps us get the work done, and also if people feel judged for something, they're already feeling judged usually, and that's part of what feeds the addiction. Coming to therapy where they're supposed to get help and they're getting a heaping pile of judgment instead is not going to help them get better, So we have to create that safe space. And, again, having that relentless empathy, seeing people as people who are longing to be loved, and, something has gotten in the way with that. And it leads to all kinds of beliefs, feelings, emotions, and then subsequent behavior that gets in the way of that. Then we can approach with that empathy, compassion, curiosity instead of judgment. Like we all know that, the addiction has to stop. That's why they're here. That's why their relationship is in distress. We don't need to judge it or label it. But if we can hold that loving space for them as a human, then we can work together to help it change in a meaningful level, not just let's try to take away the thing that they turn to. Like if they drink, let's just don't turn to alcohol anymore. And so many times I've had people try to go that route and they just fill it in with a different addiction, right? They find something else. So it's, you can't isolate symptoms of the addiction or, these processes, of attachment, of being human. And then it's like saying, if I treat the sniffles, it's going to make the cold go away rather than treating the cold.
Yeah, exactly. So in other words, sadly, the field of addiction has been very top down, right? You stop the behavior of addiction, which I don't even like that term, or I don't like the term behavioral health, because it isolates behavior without looking at the human being and the pain people have been in. Really endeavor to walk a mile in people's shoes about their relationships and their lives. Their pain makes a lot of sense, and using will make a lot of sense. So the work that we're doing is always bottom up. Yeah. And move people into that moment where maybe they've elected to use, and we'll follow that thread into what was happening, and what the narrative was around that, and then the pain that gets generated from that, and how that moment of using was a way of just trying to somehow mitigate that pain. But the piece that we hold that is so obvious to us, but not always obvious to people in the addiction field or other models, is that pain is happening in the absence of people really having in their bones a sense that there will be loving others they can lean into. And so we're creating that process in therapy, which can be a tall order, as we all know. It's not always easy work, right? Giving people an alternative, which kind of takes people back to baseline, like the alternative should be being able to lean in. That's our birthright, but it's just not a given, right?
Right.
We try to create that and work from that place.
Right. That's so good. And I love what you said about people not seeing loving other safe resource of acceptance to lean into, right? That's often how they found their way into addiction to begin with, even if on accident. And they might have even found, some eclipsed version of acceptance by, even in childhood by other people, peers who were also finding their way into addiction. So they got into addiction, through a gateway of felt sense of belonging with other people who didn't feel like they belonged, and they're self-medicating. So we're all self-medicating together. And, I think it's really beautiful. Sometimes I have clients that are able to sort of start, when they're progressing in their work, stepping back and realizing, hey, like I hang out with these people and that's all they want to do. And it's like, wait, they don't even know how to relate or have a conversation without drinking alcohol or smoking weed or doing this or that. And, it's like, I don't want to have to need to do those things to relate to people. I want to be able to have like meaningful conversations and connection. And so maybe this just isn't my tribe. Like if that's how they got to relate, I'm not going to judge them, but it doesn't feel like relating. It just feels like all we get together to do is like, maybe we don't know how to connect to each other. So we say, hey, let's just start drinking. Let's play a drinking game, or let's do this. And, and they're realizing I can't get that depth of connection even among friends and peer groups. So, they're able to hold space for that even in themselves without it triggering. So it's like part of them getting that stability and like, okay, this isn't acceptance anymore. And I want to go be among people that I can get this without having to do that,
The very thing you're talking about, in my experience in EFT, happens to be one of the main processes, if you will, that people come in, and addiction has now become the thing that organizes their cycle. And at some point in time, these significant others or these partners partied a lot together. That was a big part of their lives, and one person seems to grow out of it, right? And then
which changes the rules of the game.
It changes the rules of the game. Exactly. It changes it entirely. And now the one partner who keeps doing it starts maybe hanging out with other people, or never really kind of stops the momentum, and their partner who has stopped using is getting very activated by their partner's using, right? And now, as this evolves over time, then the addiction becomes the central thing they fight about. And that becomes the thing that organizes their dance of conflict, right? And there's so much to it at that point because people are in really different places.
Well, it makes sense. If it was addiction, that was how we found a way to come together, and now we're not having addiction, then it's hard for us to be together.
Right, which is a really tricky moment, right?
Yes.
The EFT therapist.
So I love that you said like that can be one of the, main things, one of the key things that you find brings people in. Can you maybe speak to some of the other key things that you notice that bring people with addiction into therapy?
Well, a lot of times, very honestly, it is an addiction that brings them in. What I've noticed that's so odd and has confused me at times, I mean, I have my own theories about it, but is when people come in and they don't mention that there's an addictive process. And so maybe doing an assessment, no one's mentioned it, and we start the therapy, and because of the novelty of therapy, maybe it starts getting a little traction, and we start hitting an impasse kind of early, and it's really curious. So at a certain point, I thought, I don't think I've done enough direct questioning in the assessment about, are substances part of your world, or is there any kind of addictive process? And then you come to find out much more quickly, yes. But people have a lot of different reasons for not acknowledging there's something going on with an addictive process, whether there's a sense of shame, or in people's histories, families used, and they didn't want to have to acknowledge it either themselves or with their partner, and they're protective. Or I hear people say things like, I remember one case in particular where a couple came in, they were just in a lot of distress. No one mentioned anything about addiction. It was a heterosexual couple. The wife was the one who was the driver of therapy, but she also said, I'm not so sure what I'm going to get out of this because I don't really think I know my husband all that well. When I did his individual assessment next, he said, things are decent with us. They had some challenges with some of their kids that were very difficult. But he said, one of the things I've noticed is when she starts drinking past glass number 2 of wine, we escalate terribly. And he said, the hard thing for me about talking about this is we also have some of our nicer moments when we go out to dinner after a hard day's of work. We have a glass of wine, maybe 2. But he said, we often have lovely conversations. We feel really connected. So he said, the idea of taking this off the table for me is hard because it'll mean also eliminating that. So people have a lot of different reasons for kind of being protective or avoiding it or not mentioning it. And other times it has created enormous consequences. And so those are the more obvious moments,
Yeah. And that, that really brings up a lot too. Like when they may come in and they even, like let's say alcohol is their thing and they love the taste of it, which is going to be an even bigger part. They not only love what it does for them, but they love the taste of it and they struggle with that moderation, or, to cut that attachment with it because they love it so much. They can't imagine not being able to have that in their life, but again, partly it's taken on a life of its own, right? It's not just I have a little bit of it and I could control it. It's I love it so much that it runs the show,
Right. No, that's right. And so that becomes a little more difficult. So what I always hope is in the beginning of therapy, as we're assessing goals, and I often, have people tell me what their goals are, and then I start asking different questions to expand upon that. But essentially, I'm always searching for, is there an attachment reason for them to want to be in therapy? And there tends to almost always be. People might have different ways of languaging that, but when people start to name, if we were able to have a successful experience here, we'd be closer, or we'd be more harmonious, we work better as a team, we'd have a more solid romantic life, whatever that might be. Mm-hmm. When they talk about their using and we put those two things against one another, they're usually contradictory. Like, I'm not going to be able to keep using and have the closeness with my partner I really want. Mm-hmm. So can we start talking about this in a different way? What is it about what's happening that would lend itself to you using, because it gets in the way of this really important goal? And there, once again, we're leveraging attachment, right? Mm-hmm. And that becomes a very, very powerful vehicle for people considering a different path or set of options in their relationships.
Yeah. And I'm curious, so as we're talking about, people coming into therapy, what may bring them into therapy, and how addiction isn't always like their reported reason for coming to therapy. It's something we sort of find out through the process. What is it about trauma and shame that addiction can become such a strong part of?
Don't feel. And that has a lot of value to it. I don't know that I can think of a single case where I've worked with addiction where there's been a lot of trauma. And in most cases, I'm actually at this point in my career, very firm believer, you scratch the surface of addiction and trauma's right there, and you scratch the surface of either one of them and shame is running the show. So I say all of that because for any of us who have done our own personal growth work and really done the deep dive into opening our own Pandora's boxes, shame tends to be there. And that kind of pain from trauma, pain from shame, it's almost intolerable. And so it makes good sense why people would use. At the same time, though, it also takes on a life of its own, and it gets in the way of so many of the other really meaningful things, not least of which being really close with your significant other. So the thing about addictive processes, whether they're substances or they're behavioral, they work, and they work really quickly. Mm-hmm. They work, substances immediately. And in that moment, you're not feeling the pain of your trauma. You're not. You used a really lovely phrase a few minutes back, but some version of people experiencing things beyond the pale of humanity. And it's just really hard to grasp that could happen. And then I would also say, in terms of the concentric circles of people in our lives, the closest ones being the closest relationships, if we have had horrible things happen at the hands of those who have been there supposedly to take care of us, the meaning is immense and the pain is immense, exponentially immense. So using makes good sense. It just doesn't work. And that's what Bowlby would say, right? They're no good or bad attachment strategies. They're effective and ineffective.
Yes. Yeah. And that, makes sense too. What you're saying is like, of course, not everybody that has trauma turns to addiction, but and also myself, I found that I've not ever worked with addiction where there wasn't trauma, so it may not be that all trauma equals shame, but or equals addiction, but underpinning most addiction is trauma. And I think a lot of it is, the impact on our heart and soul as a person from the trauma has left us with the meaning about ourselves that we're somehow inherently no good or unworthy, blackened because of it, broken beyond worth and value. And that's, what shame is. That's the view of ourselves where shame lives. And then, trauma often, that's an impact on us from trauma. And then we've got to find a way to cope with that, especially if the trauma, if that's how we're viewing about ourselves. Well, why would we think that if we turn to somebody else, we're going to get a different answer about ourselves? But also more especially if the trauma came from attachment figures. So you were already given explicit messages about yourself through that trauma that just perpetuated. And then you turn to addiction, but then the impact of the addiction can leave you feeling, like the things you might do under the influence or the way it keeps you isolated can only, like a mushroom in the dark grows bigger, it sort of keeps on the cycle.
Well, and then people start having self-reinforcing experiences over and over and over again that if they're using and either they can't quit or get their arms around it and they don't feel good about themselves, or if they do awful things when they are under the influence, it only reinforces what a bad person they are. And when it pushes people away, it only reinforces, well, nobody would want to be close with me and nobody's going to be there for me. And then again, just keep feeding the beast, right? And the addiction starts to gain more and more momentum and kind of burrow further and further into people's lives and become more and more dangerous.
Yeah. Yeah. So it's a complex cycle, right? Where we may use to cope with the pain, but then we feel ashamed about the way we've coped. And then, the solution becomes a problem again and keeps us stuck on another cycle of insanity. So, and, I love EFT is that we just offer so much hope for people that, we don't condemn them or judge them. And we make space for them and we make sense out of their suffering and their coping strategies, even if they're ineffective. And through opening that space and holding that space without judgment allows us to actually get to work and do the work that needs to be done. I like how you say, make it alive in the room, right? Because that's where the neurological rewiring happens, right? We're going for long-term change here, not first order change. Doesn't mean we may not do some, short-term remediation to help co-create safety or at least prevent the wrecking ball from continuing to come down and knocking down our work as we're trying to rebuild it. But certainly, the core of the work is on that emotional levels. We know that rolls with our neurological order of operations, and the rewiring happens on the survival neurological level that our body has access to in that place. And that's what drives behavior hand and fist all day long, right? Top down is like trying to soothe the amygdala with the prefrontal cortex. And we can't do that. Literally, our brain structure is not wired for that because the prefrontal cortex shuts down when the amygdala is online. So, we literally cannot do that. So heart to heart, right, is amygdala to amygdala, soothing the amygdala. And that's why we work with the emotions on the emotional level to help get to the core of the problem and rewire it emotionally on the level that exists and that they have access to under distress.
Which in addiction circles is the exact opposite of what is encouraged. I often say, don't take people who are newly considering moving into recovery into their emotional worlds. They're not going to be able to tolerate it. And I mentioned to you as we were just reconnecting here before this conversation, one of my great interests right now is creating this program based on my book. And this is going to sound really weird the way I'm going to say this, but when people are in residential treatment, they have 24/7 support and they can't leave. I guess they could leave against medical advice, but most of the time people don't leave. But the idea here would be to move people into their emotional worlds, destabilize them a bit, which sounds really odd, but it's continuing to create that same experience like a container that holds us when we're using, and being able to kind of dismantle that container some so people can encounter the things they've been trying to self-medicate for so long with a lot of support. So if we extrapolate that to our private practices, we are hoping to be able to dismantle the addictive process enough, help see the humanity and why somebody might be using, trauma or no trauma, and be able to lean into a partner with that distress, right? And have the attachment connection be the replacement, ultimately, for addiction, right? That's what we're moving toward. And that's what our model does beautifully. So I recommend anybody doing EFT not to be discouraged if you get a whiff of addiction coming into your practice. I think the work you already know how to do is super helpful.
Yeah. And for those of you who, from the street, who might be looking for therapy, to know that there is a place for you, find an EFT therapist, and that there's a place for you, we can work on the addiction together in conjunction with the work and really find deep and meaningful healing, and I love that message for therapists, like, kind of don't be afraid, and maybe attend a training with Michael Barnett so you can learn how to, build the scaffold properly throughout the course of therapy with EFT. And, we did a previous video about trauma and addiction. And so I think we talked a little bit more about the process of EFT and the structure throughout in that video. So hopefully you guys will find that as well. But I love it. And I love that idea of creating a container, right? And so warning, insert corny metaphor coming. I always talk about, and Catherine Ream always talked about soup of secondary emotion. I always think about people's early reactive emotional experiences as like soupy, and we need to have a container, and early on we're the container, and sometimes we're the container, sometimes we're the spoon, right? So, but if you don't have a container, you got nothing to put it in, it's hard to sort of hold on to that. So first and foremost, so we have to have a container to hold it, and then we can be the spoon that stirs stuff up, knowing that we have something to hold it.
Good metaphor. That wasn't corny. That was good.
I love visual images. Is how my little ADHD brain sees the world. So, well, Michael, thank you again so much for coming back. And I really hope that folks get your book. And now this is a book that is open for like the general public, like people who are actually suffering from addiction that are really, could benefit from using the attachment frame and what EFT has to offer through this workbook. Can you tell everyone where they can find your workbook?
Well, the easiest place to find it is on Amazon under the title, the Emotionally Focused Therapy Workbook for Addiction. And you can also go to New Harbinger Publications. You can find it there as well.
Perfect. And Michael Barnett is the author. And of course, if you're watching this as a video on YouTube, I'll put a link to his book on Amazon in the description box for the video. And so Michael, if folks are interested in maybe finding you and, getting trained in addiction, treating addiction with EFT, or bringing you out to their community, or maybe people that are not therapists are watching this and thinking, hey, maybe I want to work with Michael Barnett. Like, how do people find you?
Well, you can go to my website, which is michaelbarnettlpc.com. And there's a page on there that has all of my trainings listed. You can go to simply my email address, which is Michael B. LPC, which is like Michael Barnett, licensed professional counselor, Michael B. LPC at Gmail. And if anybody who's watching this is connected with treatment centers who might be open to incorporating this kind of work. I'm already working with two different folks, one up in the Bay Area and one right here in Pasadena, where we are piloting programs that are like based on the book. And the other thing I'd like to say about the book is it is wonderful for people struggling with addiction who would like to have another relationship with their addictive processes. But I'm also hearing from EFT therapists who are emailing me that they're using it with their clients in session, and it's been really helpful. It's very non-pathologizing. And in this one treatment center up in the Bay Area, and this was really powerful, that one of the things that creates change is when people in treatment centers start to adopt a certain philosophy. It could have been a 12-step philosophy in the past. My book is not 12-step organized. But what this woman who runs the program told me is their patients are walking around the unit talking about the book, talking about attachment, thinking about their addiction from a much more soft, non-pathologized, accepting way. Redemptive. Thank you. That's beautiful. And so that kind of feedback has been really powerful. So it's not just for the individual who would like a guide to help heal some of what's been going on the inside that they've been using addiction to heal, but the applications for an adjunct to therapy or even in treatment centers, it's starting to happen. So just wanted to plant that seed.
Yeah, absolutely. So if you guys are connected to an addiction center and you're watching this, might be interested in integrating the workbook and its concepts. And I'm sure, Michael, you'd probably be more than happy to work out maybe doing a training with them, coming to their facility and helping them. That's also available and phenomenal. I highly recommend it. Because I think a lot of addiction centers don't get enough good training. So it's going to be amazing. So I'm going to make sure again in the description for the video, I'll put Michael's email address along with his website and the link for his book. So make sure that you just click down to the video description for this. And, thank you again so much, Michael, for being with us and sharing your wisdom, and congratulations on your workbook. I think it's an amazing resource. It's about time we had something for addiction. I know a lot of therapists are looking for a tool for their clients that are struggling with addiction. And finally, we have one now.
Well, thank you for having me on the program. I've really enjoyed our time together, and I hope it's helpful for folks.
Absolutely. Thank you so much to our viewers for just watching and your continued support, and for giving me feedback and ideas for new topics. And, I just want to say thank you to everybody, and make sure that you look up my website. You can find me at drbell.com. Or wehearttherapy.com is where I have my trainings listed, or you can come do an EFT training with me out here in Las Vegas at Southern Nevada EFT, so snveft.com. I'll put all that in the description for the videos. And again, just thank you everyone for watching this, and I wish you happy healing with your clients. And if you're a client watching this, I wish you happy healing with your therapist. And if you haven't done so already, make sure that you hit subscribe, because more videos are on the way.